right, let's start with number one. Why is this an important thing to think about? Going both individual and family systems, and how can it lead to relapse? So I'm going to propose a both and individual and family work, not either or. The first thing is that the statistics are showing us that more than half of the children who live with an anxious parent end up meeting the criteria for anxiety disorder itself. That shows you that there's a dance between parent and child around anxiety. So if you only take one part of the system and change it, you're putting one hand behind your back, or we have to look at the whole is greater than the sum of the parts. So cognitive behavioral therapy, they did a study, and like I said, in the Journal of New England Medicine, where after 12 weeks of CBT, the children and adolescents that were treated were very much improved or much improved. I'm telling you, if I had a model that had 60% success rate, I would be doing the happy dance. But here's an interesting finding they found in the study, but it wasn't a permanent cure. It wasn't what I call sticky, the stickiness factor. That after the initial positive outcomes were there, it faded over time. Now ask yourself, why would that be? That's an important conclusion. So why? CBT focused on the child's role in the anxiety disorder, but neglected the parent's response to that anxiety. And I underline that, as I lifted this off the journal. And they further found that even when the parent participated in the therapy, it was just kind of giving them a summary of what happened in treatment, but their emphasis always remained on the child, what they were doing, not the parent. And the source from where this article comes from, or the journal is quoted, and you can get this if you Google it, The Anxious Child and the Crisis of Modern Parenting. Google it on May 2020, The Atlantic. You don't have to pay for it, it just comes up. But it's a fascinating article around this issue. So over-accommodation, what's the definition? Well, it's when the parent or caregiver changes their behavior, or it can move into their whole lifestyle to help their child avoid or lessen their feelings of anxiety. And again, this is the key. I always say, parents, is there imminent danger? And when there isn't, they have to really look at this. Is this helping their child have anxiety, maintaining the anxiety? So what happens again is what I said earlier, it prevents anxiety coping skills from developing, like the young lady that was not going on the bus to go to school. There's two types. Number one, there's participation over accommodation, and there is modification over accommodation. And this is something that's important to share with your clients of what the difference is. Both are not good, but one is a little bit worse than the other. So let's go to participation over accommodation. And these are slides that you can give your parents. Sometimes I have the kid present if they're older. Sometimes I don't, on a case-by-case basis, because kids are like, I want to know what's going on here. That's part of my anxiety, is I don't know why I'm so anxious. So you got to use your clinical judgment. The parent changes their behavior they're actively involved, helping their child avoid or reduce the anxiety. This is an example where the parent turns off the lights on and off 3 times because the child is compulsive. The parent's saying, I'm actively going to help you maintain the OCD. They don't say it, but it's happening in a dance. The second thing is that the parent, these are just 2 examples. Parents always order for their children at dinner because the child won't answer the waiter. This is actively helping maintain social anxiety. And it's out of the parent's awareness. I say to the parents, don't blame yourself. You didn't have a handbook on this stuff. The point is where do we go from now? We can't change the past, but what are we going to do in the future? And that's something you want to write down because parents feel so bad when you show this, and you just got to say, look, this is you didn't have this information. Then I'll say this is when it gets a little bit harder because it becomes a lifestyle change where it actually becomes ingrained in the lifestyle. So they change their lifestyle or daily life to walk on eggshells to help the child avoid or reduce. And they get the siblings involved in this too. So they stop inviting guests to the house when the child is home because of social anxiety. So they've changed their whole lifestyle. Even the siblings are like, "Why can't we invite guests over at the house, my friends?" Because your sister or brother can't handle it. And so then we see siblings walk on tippy toes around their brother's room because he doesn't like the noise. Again, the siblings are changing their lifestyle. So it may start as active participation and morph into lifestyle modification. And again, once it becomes lifestyle modification, you need a blowtorch sometimes to get it off the barnacle of the ship because it gets part of the dance. So the end piece is that childhood anxiety is not only a child problem, it's a child and parent problem. That's the reframe. So, current anxiety treatment, I think right now is not including the active participation of these members of the family to change the over-accommodation dance. And it's because a lot of mental health professionals didn't even know this, just like parents. And so a key point is that parents are going to sacrifice short-term anxiety pain relief, but long-term coping skills never happen. So they may stop the anxiety in their child, but it doesn't leave room for any coping skills. So they're not going to wake up one day by osmosis and say, gee, I'm over accommodating. What do I do? They'll just keep going. And the definition of insanity is doing the same thing over and over again.